Hello.
Hi.
Hi.
So
Hi,
everybody. So Andy's here with us. We're going to do a little Google Meet recording, a little bit of information about herself as a title sponsor, like what we're doing with Rock Your Registry, more information on that. And then that's pretty much it. We just wanted to be able to highlight the amazing clinicians and other people in the community that are supporting what we're doing, because we do agree that this is something that's a community effort.
Yeah.
It's definitely not
Absolutely.
just one of us. So we are going to have you introduce yourself, Andy, and tell us a little bit about who you are and what your credentials are, and then we'll kind of say how you're involved with Rock Your Registry.
Yeah, perfect. So I'm Andrea Singer. I am a nurse practitioner and I specialize in pediatrics. So here in Las Vegas, I am currently employed at a very, very large practice, but I will be opening up my own practice that has a slightly different model. And we are set to open August 1st of this year.
Exciting.
Yes.
That's right around the corner.
And
I know.
right next door to me.
Yes.
I know.
So we're going to have like the pediatric corner right there
Yes.
at Bottega. It's going to be great.
Yeah. Very exciting. There is someone in there today, and I was like, what's happening?
Yes, me too.
I was like, what's happening?
It's been like
And
that
I was
the whole
like,
week.
I was like, you know what? It's because she's coming a little later. I'm not going to freak out. We're going to be efficient here. So, so you're going to be at Bottega Exchange, which is actually where the Rock Your Registry event is going to happen in June.
Yes, in June.
So
June 7th.
June 7th, Saturday. There's going to be yourself as part of the panel, and then also some other vendors and guests, and what else?
More sponsors. We have
some other
more
sponsors that we're going to highlight and talk about. And that's, so that event is designed kind of as your practice is developing too, and what you're trying to do, designed to give moms and babies an opportunity to understand what's out there when it comes to resources.
Yeah, because I think most people feel very kind of alone in the community, right? Which I think is fantastic, because for me, coming from LA, I feel like compared to there to here, I'm like, there's always something in my face. It's such a small community here, but
like events and that
events
kind of stuff,
and people, obviously providers too. I feel like they're a lot more open to wanting to collaborate versus practicing in LA for 15 years. I felt like everybody was just doing their own thing, and it was really hard to collaborate with other practitioners. So this to me, I think is such an amazing situation, and people's heart is just in a different place here than what I'm used to.
We're trying to find, as I'm sure you've experienced too, as a pediatrician, we're trying to find the other people who agree and kind of believe in similar things. We have different ways in which we practice, but really understanding like who to direct them to.
Well, I think also me, which we had a little small conversation with Andy, when I had that conversation, I think having that heart, the passion to really truly help people, but also the philosophy. There's got to be some overlap in our philosophy and the way we approach health. Obviously, our practices are different, but the actual philosophy and the ultimate goal is to truly care for these people and help them thrive in a natural way as possible without having that immense kind of big pharma, big hospital, big everything, taking all of that away. I really praise, and I'm so excited that Andy decided I'm leaving the big guy so that I can truly help people one-on-one. So that was really exciting when I got to talk to Andy.
So tell us a little more about your practice, how the model works, and I think that's please. Tell us more.
Please share.
All right. Yes, absolutely. So the Pediatric Collective is a comprehensive primary care for children. So I will serve babies, new fresh babies, all the way through age 21. Okay, so it's a little bit different in that it's a membership-based model, which is going to provide me the ability to take more time with the patient. It's actually the way I see my physician. It is the best decision that I ever made. I still have insurance. I carry my own insurance, but I see a physician, and this is the way my model is going to work as well, where I pay a monthly fee and then I never get an unexpected bill. I never get billed to go to the office. I have unlimited visits, and the visits are an hour long. So that's the same model that I'm going to utilize. Currently, unfortunately, it's just the way that healthcare is today. with like an insurance-based model, my visits typically I'm in the room for about 7 to 10 minutes. And I just feel like it's not enough time, especially because I'm a very relational based clinician.
Yeah.
And I really take into consideration that not only do I serve the child, but I serve the caregiver as well. And it's just so important that mom's needs are met at their child's visit, as you know, getting the child's health needs met too. So there's so much, it's just such a big umbrella that I crave to cover. And the current model right now is just, I just don't have enough time. So time is the value add here.
Yeah, we definitely, I mean, with the way that we practice as well in our respective, me being mobile, Dr. Rhee in this lovely office we have here, or she has here, we understand that flexibility and asking those questions can definitely take longer to even understand what you're talking about than 7 to 8 minutes. Like you asked me a question.
Yeah.
And I need a minute to process that, or, you know, not get crazy, angry or whatever, have a response like to
or
that
feeling rushed
through
it. Right. And Andy, you said that, you know, you would like to spend about an hour with your clients. You said, how long do you spend now in your current situation?
I would say maybe 7 to 10 minutes typically. And it's not enough. It's not enough time to really get comprehensive and really understand like the root of the problem. And I don't know if any of you have ever felt this way before. I certainly have, where you're in a room with your provider and they're like, that's normal. We'll brush that off. And a lot of times it's, maybe they don't have time. And I get it. Like we're rushed, we're busy. And I feel like a lot of things get missed, or even just our emotions and maybe the reassurance that we need as a parent can get missed too. So you might leave with more questions or forget, or maybe with me, like I remember as a new parent feeling nervous to even bring anything up because I felt so intimidated by the pediatrician. So we are avoiding all of that here at the Pediatric Collective.
Yeah. Right.
Yeah. And I even think as you guys were kind of explaining that and really putting that into perspective of how much time that is, how much interaction, conversation you're able to have to address those concerns. Sometimes even like a 7 to 8 minute visit in person with a 3-month-old or with a 3-year-old can be really challenging for the parent to get to. So that could be a phone call.
Yes.
Like that doesn't necessarily, or a telehealth or, you know, situation, or that doesn't always need to be that full hour-long situation. And so even being able to have the flexibility of the direct primary care person to, or provider to say, I could give you a call on this, or prescription through, or whatever it is in your wheelhouse, is more flexible in that model versus maybe a traditional practice where they can't because of whatever reimbursement rules are in place.
Go ahead.
Oh, I was just going to share, based on a time situation, you know, most chiropractic offices, you know, the way I used to work in LA, and again, just going back to the time, I mean, I don't always say just because you have more time, it's going to be quality service, right?
Sure. Sometimes you don't understand.
But I mean, my old office, I saw 2 patients in 15 minutes.
Wow.
So, and then here, my adult patients are 15 minutes. And then my little ones, when I do floor time with them, same price right now. So but it's 30 minutes. So then I have colleagues like, what do you do with them for 30 minutes?
And you're like, it's wild.
Like, I don't 30 minutes is not long enough when I have, you know, newborns, right? But I have to cut it off at some point. So just bringing perspective back, you know, I'm really excited to learn more about how you're planning on expanding, because you know, quantity of time doesn't always equal to quality of time.
Yes.
I have plenty of colleagues, they spend literally 5 minutes, and patients will say, I feel like I was so, like, the doctor was really present with me, even though it was only 5 minutes.
That's amazing.
So it's a skill in itself. So I'm really
Yes.
curious what kind of, I mean, and obviously having a new practice in a whole different model, there's going to be a lot of fine tuning that you're going to have to do in the next year, right? What's going to work, what's not working. So I'm really excited to kind of like learn more about how that looks like in regards to the way you're going to be practicing when you come into this space.
Yeah, absolutely. So, you know, what's interesting about doing this kind of model too is the accessibility that the patients and patients' caregivers will have to me, which right now in my current, you know, like working in a big big practice that takes all insurances. To find me, unless you're my friend or like have my number to text me, and of course I answer DMs on Instagram too. But otherwise, to find me traditionally, you have to call a call center. You wait for a long time. They'll send me a message. Maybe a week later, I'll get to that message, and it'll probably say, "Let's make an appointment," and then book a couple weeks out. And it's hard for busy parents, right? There are a lot of different things that can be solved. That can be solved over the phone.
Yeah.
And why do we bring you in for it? Traditionally, they want to bill your insurance. That's why they bring you in. So under this model, if it can be solved, it's kind of like a triage, you know, like can we solve this over the phone in 5 minutes? Great. That is great for the busy parent. Maybe you don't even need to come in. Maybe it's just a conversation. But if you want to come in, we can make that time. If you want to come in really quickly and we just need to boop, boop, strep, swab your child, positive, okay, we'll get them what they need and you're on your way so you can get back to work or back to life or whatever, we'll do that too. So the accessibility is just huge here.
Yeah, because maybe that's like you were saying with that timeline of the 3 weeks, 1 week to get to a message, and then 2 weeks beyond that. Obviously, if it's very, very severe, they would be going to the ER or the urgent care, but sometimes not. And sometimes
not necessary. Sometimes
they're in a 3-day waiting period of that time to then still end up going to urgent care or something like that. So it can be like, no, you should go now versus a week later of that conversation. So thank you so much for explaining that and kind of like clarifying. I think it's so interesting with like kind of how all three of us in a room and talking about this is like, I'm almost always 98% of the time, 30 minutes, 1 hour in the home, partially because I'm going there. So there's a lot of scaffolding work that we're doing, even if it's not a direct intervention. But so, an hour for me, closer to like 30-ish minutes for you. And then, still like an hour, up to an hour with Andy, but also flexibility to say it could be a Zoom visit or it could be a 15-minute phone call. And that could be what works for them. It's just kind of cool to see that variation. So let's say a mom, sees this conversation we're having as like, oh my gosh, I'm having a baby in July, or I have a newborn now. What should I do if I want to work with Andy or like in the future for future babies? What should they do?
So they will come to my website, but first thing they're going to come to my Instagram because my website is still currently being built. It's set to be out in about 2 weeks, which is so exciting.
Okay. Exciting.
Yes. So website will be there with like a kind of a landing capture page, basically. So best way to reach me currently over the next few weeks is through Instagram. So at Andy _ your pediatric NP, and we can capture you there. But what's really great about if it's a new mom, a pregnant mom, my first 3 months, the way my model currently is my first 3 months are home visits. I don't want baby coming into the office at all. I want to come to baby and come to the home. So
that
all included in price.
So your 4th trimester is like extended into that time of saying we're at home, I'm at home, you get some fresh air and go out to see Dr. Rhee and you come back home. So I could totally see how that works. Thank you for sharing that. We will definitely have that contact information in your like signage and information and stuff as we're going through getting closer to Rock Your Registry in June. If you could pick one thing to have your mom's even pregnancy that they're registering for, that they're building their little list or asking for help with, what would it be? What would you suggest they put on their registry?
I feel like it's a controversial answer, but one thing it was life-changing for me personally. As a sleep consultant. Now, I don't think that you need that right away. Okay. But we want baby to be developmentally appropriate for that. But I was the person that needed sleep after a certain amount of time. I breastfed babies for 15 months each, years of breastfeeding here. And, so lots of nighttime wakings, and we chose a great age to sleep train. 9 months is when we did it. But, for 9 months, I was awake every 2 hours breastfeeding a baby. And investing in a sleep consultant was life-changing for me. And there's multiple ways to do it. If you find a good one, and I've got multiple different ones that are great. I'm actually a certified sleep consultant too. I went to school afterwards for it after just having such a great experience. But I feel like it's a great service, and they are taught to practice the way that's best for you and your family. Whichever way you choose to sleep and your child chooses to sleep, they should be able to mold towards that, but just help you and your baby get the right tools.
Sure. And I would definitely agree. I heard a term last year, I think it was by Aisha from Vegas Family Doulas. And I heard a term from her. She had called it sleep shaping. And I thought that was like nice, really nice, general kind of broad, because that really, to your point of whatever works best for your family, if that is co-sleeping, if that is sleeping on a schedule, what is that? Because that's where you have to be able to figure out. It's basically just finding supports for you and the baby, but for you to get the sleep that you need, because typically they're going to sleep wherever, but it's a matter of, are you next to them? Or how does that work for you guys and your family? So that's a great option. We will definitely be having at Rock Your Registry a sleep consultant. We have someone who's amazing. She's going to be there as in-person as a vendor participant, and then also obviously sharing resources. So
knowledge,
thank you so much again for your time. We've shared a lot of great information, and we'll keep sharing that. Have anything to say, or we go?
Just get in here.
I know. Just messages or see us or DM any three of us, because we're pretty active on the Instagram and on our websites too. I mean, if all else fails, Google our names, and ideally that will come up. So thanks again, and have a wonderful weekend. Bye.
Thank you, Andy.
Bye.